It's been so bad, Sarah. Hold on, it's not live. We're almost... It's loading. Okay. Hi. Welcome to the MRF's April 30 and 30 CureOM informational session. I'm Lauren Johnston, the Program Officer for Rare Melanoma Subtypes, including CureOM, and I'm so excited to have everyone here joining us today. Dr. Sara Selig is here, and she's the co-founder and director of the CureOM initiative. She has an amazing presentation. Please feel free to send us any questions during the presentation, and we'll do our best to answer all of them during our time or afterwards on our social media channels. And at any point today, please feel free to email cureom@melanoma.org. Now I'd like to introduce you to Dr. Sara Selig.
Thank you, Lauren. Hi, everybody. Welcome to 30 and 30. It's a real honor to be here with you all today and be a part of this great MRF team that has been hosting these events all month. I hope you've been able to join a number of them. They've been really great activities to do from home. So I thought that I would just open with a little bit about myself for those of you who may not be familiar, and then we'll go through some slides just kind of giving an overview of the CureOM program in hopes that it may be helpful to some of you. So some of you may know, but I got involved in the ocular melanoma community after my husband, Greg Strax, was diagnosed in 2006. I was a fourth-year medical student at the time, but had never heard of ocular melanoma before. And so it was really trial by fire that Greg and I learned about ocular melanoma. At the time, there weren't really publicly available resources outside of our physicians' offices. And we just felt that there was a huge need in the patient community. And over the course of 5 years that Greg and I dealt with his ocular melanoma, we felt that we could not only advocate for him, but we could advocate on behalf of the entire ocular melanoma community. And so CureOM was born. And CureOM is actually an acronym that stands for Community United for Research and Education of Ocular Melanoma. And in many ways, the C of CureOM felt most important to Greg and me and our families, and just to be in community and surrounded by community. And I think Greg was a psychologist, and I think Greg felt most intensely that the community piece was needed on the patient side, on the caregiver side, and on the research side, and that in community, all working together as a team, we can make a difference and we can find the cure. So with that, let me see if I can share some slides with you all. Lauren, can you see those?
Perfect.
Okay. So I thought I would just go through a little bit of what CureOM is and what we've built over the years. And like Lauren said, we really welcome comments and questions, and please feel free to chat them in, or afterwards, please feel free to email cureom@melanoma.org, and we staff that email address, so we'll get back to you very quickly. But here are some pictures of Greg and me. On the left, you'll see an engagement photo of ours. On the right, you'll see Greg with his eye patch in Philadelphia in 2006. It was Greg's right eye, as you can see, that had the melanoma in it. And then down below, you'll see my daughter, Greg's and my daughter, Juliana, and me participating in Eye Patch Day, which is an international awareness day that we do in partnership with OcuMel UK. And Juliana, we talk a lot about Greg. He never wanted to be known by his disease, which I'm sure many of you who are patients feel similarly. So we don't focus on that a lot at home. But Juliana does know about ocular melanoma, and she knows that we're continuing to be involved with the Melanoma Research Foundation so that no other family has to lose a daddy. So that's how we talk about that. But Greg wanted to be known for much more than his disease, and I trust that he is, but I think his legacy in leaving behind CureOM is an important one as well. So the mission for CureOM is here on the slide, to support research and accelerate the development of effective treatments and ultimately a cure for ocular melanoma through innovative strategies, including international and interdisciplinary collaborations, which you'll hear more about, and to improve the lives of people affected by ocular melanoma by creating systems and programs to provide education and support and to advocate for the ocular melanoma community. So we should revisit this slide at the end of the presentation, and you should keep us on our toes and make sure that we are actually addressing the different components of this multifaceted mission statement. We have a number of different CureOM resources. Many of them can be accessed online. I'm going to go through a number of them here in this presentation. We are an organization that always wants input and feedback from the community. So number one, I might not cover everything on this list today. If I don't cover something that you want to know more about, please email us, please chat in. And if there is something that is missing or a resource that you think we should develop, please also let us know that, because we're always creating new resources and wanting to meet the needs of the community as best as we can. So the backbone really of our program and our patient education and support is our annual Eyes on a Cure, annual patient and caregiver symposium. And hopefully some of you listening have actually been to this meeting or might be in one of these pictures. But these are pictures from past meetings. And here's a list. This is our 9th year holding the meeting. And as many of you know, we were supposed to be together last week in Houston for the 9th meeting. And because of everything going on in the world right now, we have postponed that to November, where we hope that we can get together again in Houston. And this is really the backbone. We bring the patient community together from around the world for about 2.5 days, about 2 days, it depends on the year. And we bring really speakers in from around the world to these different academic medical centers to talk about the latest in terms of clinical care, in terms of research. And then we always have a really robust patient support track as well. And we have support groups, and it's sort of the type of meeting where there's a ton going on and you can really pick and choose what information and what support is most helpful to you that year. And I think some patients and family members choose differently each year depending on what's going on for them. So we hope to see you all in November. Other education and awareness materials and resources. So right now on this slide, you can see a number of different resources which can be accessed for free on our website. So they can be printed from the website, or if you fill out a form, we can also send you copies for free. Some of these materials are also being handed out in physician offices. So we have a number of different materials out. We'll show some of them to you. We have a CureOM, just kind of informational brochure, and the inside of that is what you see on the left hand side of the screen. This is the front of it. So this is informational about the program. You can see the caregiver support guide, which I think is really helpful with the experience of being a caregiver that I have. And then our latest educational resource is actually one that I feel pretty excited and proud of, is our Ocular Melanoma patient guide. That's on the right of the screen, and I have it here in my hand. And I have to say that I think the first time the idea of this came into my head was sitting on the plane next to Greg, flying out to Philadelphia right after his initial diagnosis when we were flying out for his treatment. And I remember talking with him about, we've never heard of this disease, don't know how to navigate this path. What questions do we ask? How do we think about this? What's coming ahead for us? What do these terms mean? And so it took a few years, admittedly, but that's what this guide is for. So it's a free resource that hopefully can walk you step by step through each along the way of your diagnosis. And so we really hope that this new educational resource will be helpful to patients and caregivers alike. And then some other resources that we have online that aren't on the slide include some flyers of questions to ask your doctor, lists of different treatment centers, et cetera, and that can all be accessed on our website. So to access the materials that are on this slide, you would go to melanoma education on the melanoma.org website, melanoma education, education institute, and then educational literature. And then the other resources that I mentioned can be found under CureOM resources. We're in the process of streamlining the website a little bit so that they're easier to find, but that's where they can be found now. And if you can't remember any of that and have trouble finding it, email cureom@melanoma.org. So other education and awareness activities that we have done include an annual I Get Dilated campaign. Many of you have participated in. So these are just some images that we've used on social media. This is typically largely a social media campaign, although these postcards that you'll see on the screen and that I'm holding here, some people have taken these to hand out in doctors' offices and use them as awareness tools to talk about eye health and to talk about the importance of a dilated eye exam. So we're always thinking about new ways to create educational and awareness material, and really welcome feedback along those lines. And then importantly, some of our support services have been developed really with the feedback of patients and caregivers, as well as clinicians in the field. So we have virtual support groups that have been created organically, really out of our patient meetings, where we have support groups and people said to us, hey, these are great support groups that we have once a year at the patient meeting, but what happens the other 11 months of the year? Is there something we can do during that time? And so over the past several years, Lauren Johnston, who is a social worker, has been working with Thomas Jefferson University to meet that need in the community from the feedback that we got. So I'll hand it over to Lauren to tell us a little bit more about the support groups.
Yeah, this came out of just everyone saying, at least at one of the first events that I was at for our symposiums, we want to stay connected. How do we keep this support going? And knowing that this is a rare disease that affects so many people across the country, and you may be the only one in your community that has it, we really started looking at what could we do virtually. So about 3 years ago, Thomas Jefferson University, who, if you've been at our symposiums, at least 2 or 3 of their social workers are always present. They kind of are our go-to, I would say, experts in the field of social emotional support for individuals with ocular melanoma. And they stepped up to the plate. And so we started, I guess it is now 3 years ago, monthly support groups. They meet every first Wednesday of the month from 1 to 2 p.m. Eastern via Zoom. It is for anyone on the ocular melanoma journey. So whether you're recently diagnosed, you're 3 years from diagnosis, you're 7 years from diagnosis, you have metastatic disease, you're a caregiver, it doesn't matter, everyone is welcome to join. The discussions are really focused around the topics that relate to you currently or could relate to you. So for example, we had a vision specialist join and talk about how to adapt to monocular vision. We've had speakers from different medical centers come and talk about how to read scans, or how do you deal with specific topics, how do you navigate things. And then there's also open discussion. So we really let those who are joining the group lead what they want to talk about. So during this time, it could be, how do I access resources during COVID? That was one of the topics that came up last month. So really, we try to make it all about you and your needs, and it's wonderful. So currently, Molly is the facilitator right now. And if you're interested, you can email myself or CureOM at melanoma.org, either one, and we can get you registered for that. We also in the past had what we call the buddy program, which was a one-on-one patient or caregiver mentorship. And we really loved that program, but felt that we needed it to be more robust and also just meet some standards that we felt weren't going to get met through just through our organization being so small. So we partner with Immerman Angels, and you can find that information on our website as well. And they will buddy a patient or a caregiver up with other ocular melanoma patients and caregivers who are similar in maybe your diagnosis or where you are in your journey. And that's just so you have that one-on-one support at any time. And they're a wonderful organization. So again, you can find that information on our website.
Great, thank you, Lauren. And thanks to Lauren for building the psychosocial support component of CureOM so robustly. We're really grateful to you, Lauren. So again, thinking back to the mission statement that I read earlier, which is really, it's the mission statement for CureOM, but CureOM is a sub-program of the MRF. And so thinking about the 3 pillars of the Melanoma Research Foundation being research, education, and advocacy, we carry those 3 pillars through the CureOM mission and the CureOM program. So I wanted to talk a little bit about some of the advocacy initiatives that we have. We're really lucky to have an amazing advocacy officer, Cassie, at the MRF, who has really helped spearhead and lead a number of these initiatives, and really, I think over the past couple of years, really helped lead us to find the important levers for advocacy in the ocular melanoma space. So I feel really grateful to Cassie for that. So I may mention a couple of things here and then hand it over to Lauren to talk a little bit in more detail. But just to mention that the 2 activities highlighted on the slide, one, Hill Day, which is an annual event that the MRF puts on, and one of the activities there, so patients and caregivers get educated on melanoma, including the rare subtypes, of which ocular melanoma is one. And so it's educated and then go meet with their legislative representatives on the Hill to talk about the needs of the community, the need for research, funding, other kind of particular important topics, that may be specific to that year. I think it's really amazing the way ocular melanoma has been integrated into Hill Day, so that all of the advocates are getting information about all the rare subtype melanoma, including skin cancer, cutaneous, and then, ocular melanoma patients are also getting educated of cutaneous melanoma. And so when people go to talk with their representatives about melanoma, it's an inclusive perspective of melanoma, which I think has been really important. So I'll let Lauren add a little bit more about Hill Day. And then on the left, you'll see a picture from just a couple months ago of a group of us who went to the FDA. We've been developing this partnership with the FDA, which Cassie has been leading, which has just been, I think it's been phenomenal, and I think it'll be really important moving forward. So I'll hand it over to Lauren to add in a little more detail. Oh, Lauren, I think
I had to unmute myself. I did one of the faux pas, so now you can all make fun of me later. So first, in regards to Hill Day, it's a great event. It's usually in March. It's usually about a 2-day training, and then you spend a day on the Hill, and you learn everything from how do you talk to legislators, why we're doing it. So we usually are asking for the Department of Defense to allocate monies specifically to melanoma funding, which is fantastic. And we've been every year getting it increased in the millions. So it's really, really exciting. And we've had everyone from our pediatric patients, so our kiddos who are diagnosed with cutaneous melanoma, and our mucosal patients, our adult cutaneous patients, and then our ocular melanoma patients. So it's just a wonderful opportunity for everyone to come together, really learn about all these diagnoses, and then take that information and tell your lobbyists and your legislators, this is why we need melanoma research funding. So it's a pretty fantastic event. In regards to the FDA session, this past January on the 27th, 11 patients and caregivers, along with one ocular melanoma oncologist, we had Rich Carvajal from Columbia University join us, and the MRF staff. We all addressed 15 members of the Food and Drug Administration, so the FDA, and we asked our patients and caregivers and Dr. Carvajal to offer their oftentimes very emotional firsthand accounts of what it's like living or caring for someone with this rare and sometimes fatal disease. We wanted them to hear the firsthand accounts. The purpose of the session was to help the FDA hear from the community, see the people who are from our community, and to understand what the needs are in the OM community when developing future medical products or trials or whatever we need. And by engaging in the listening session, we hope to be able to inform regulatory decision-making and advanced medical research, clinical trials, and new product approvals, and access to not only life-saving treatments and tests, but to also assist in standardizing the care for OM patients at all stages of the disease. So if you look in the left-hand corner of this slide, we had three main topics that we really focused on: the standardization of care and access to care, and that included clinical trials, both for metastatic disease and adjuvant trials. The impact on the quality of life. So we really wanted them to hear what the social and emotional impact can be for patients and caregivers. And then also the financial toxicity. So what does that look like when navigating insurance? If you're covered under insurance, if you're not, and how are you supposed to get insurance? And how does this drain bank accounts or not? We wanted them to hear all of these firsthand experiences. The areas of urgent unmet needs that we identified and that we asked for their support included the MRF's patient-powered registry, which we'll talk about in a little bit, and then also to establish close collaborations and communication between the MRF and these regulatory bodies that affect access to care. So our plan moving forward is we do have a report. We've been waiting for the FDA to give us approval to post it on our website and also on the FDA website. Unfortunately, because of the current health crisis going on, most of the FDA folks are not in the office, or they have been sent out to COVID sites. So we're having to wait on that. But we will have this report published, and then we can move forward with the FDA to identify the needs that we just stated and what our next steps are. So we're really excited. It's a great opportunity for us in the regulatory space. And I just think it's going to be fantastic once we're able to move forward with everything.
Thanks, Lauren. One other example of advocacy that we wanted to highlight was some advocacy that we did several years ago now, but that is still having an impact on ocular melanoma research, and that is the Cancer Genome Atlas project. So the Cancer Genome Atlas project is a landmark cancer genomics program that molecularly characterized over 20,000 primary cancers. It was a joint effort between the National Cancer Institute and the National Human Genome Research Institute that began in 2006. And there was a small window where they were looking to expand the TCGA initiative to rare cancers. I think at the time, I don't know if they expanded since then, but at the time they had opened it up to 50 rare cancers. And we were able to advocate to have uveal melanoma be included in that, which was just a huge win for the community because we were able to molecularly characterize uveal melanoma samples, which has a huge impact on research moving forward and the ability to understand the molecular footprint of uveal melanoma in order to more effectively develop treatments and one day a cure. So this is an example of one of the publications that came out of that initiative, but this is research that will support research for many years to come. And so and we've had several talks at our patient meetings to update patients on what's going on with this project. And we can arrange that at the upcoming patient meeting again. And in the meantime, even think about planning a webinar to get an update on this project as well. But again, an example of, as patients and caregivers, we can have a real impact, and we can stand up for ourselves and our loved ones, and for the field of uveal melanoma, and really make a difference. And so I think these are some examples of just the courage in the community when you see everybody standing up, and I think everyone in this community does in different ways. Again, going back to the C of Cure OM in community, and what a difference we can make when we come together and really stand up and advocate together. So just a couple other ways to get involved with the MRF and the Cure OM program. One is through MRF Galas, which I think hopefully many of you have attended or been a part of. Here are some pictures from some recent galas. Galas are a great way to raise awareness, to do some education, and really it's an amazing way to come together in community and honor members of our community. So clinicians, patients, family members, and others who make a difference in the melanoma community every day. And at each gala, we have a CureOM Vision of Hope Award. And here are some pictures from Denver, Philadelphia, New York galas where we have had CureOM Award recipients. And they're just very, very meaningful. And I think some of the most poignant speeches can be found on our YouTube channel if you're ever interested to go back and look. But I think this is a great way to get involved with the MRF. It's also been an amazing way for us to raise money for research. And so much, if not all, of the money raised at Galas goes directly into research initiatives. Other ways to get involved include the Miles for Melanoma program. And this is a program where we have 5K events in 14 different cities. You can see the cities here on the screen, 14 different cities around the US. And over the past several years, I think just about every city has had a CureOM team. That's also a great way to bring community together in the city, raise awareness, have fun, and again, raise money for research. And one example of that, the CureOM teams, the money that is raised by the CureOM teams, that money goes right back into the CureOM program, most often to research. And an example that some of you may remember from several years ago was the CureOM Unite campaign, where we were able to raise money for research and actually funded a grant. And then we were able to fund the initial stages of developing our patient registry. So really, the way the community comes together has had a huge impact on what we're able to do as an organization and how we're able to impact research in the field. So I'm going to switch to talking about our research initiative a little bit now, but first, I sort of think of the Treatment Center Collaborative Coalition. This is a pilot initiative that we launched this past year. And I think about it sort of at the center between research and patient support. And I'll tell you a little bit why, and just use the slide to tell you a little bit about this initiative before I go on to talk about our research initiatives. So this program is really aimed at the frontline providers in clinical offices, nurses, social workers, office managers who are interacting with patients and caregivers quite a lot, and oftentimes have more time with patients and caregivers than the actual physician, just because of schedules and how that works. And we were hearing a lot of feedback from folks in those positions that they aren't the ones getting to go to the research meetings, and so are kind of describe themselves as starved for information and starved for the latest information about research. They also reported to us, we got feedback that sometimes they felt isolated at their own centers, and they're such dedicated people wanting to meet the needs of the patients as best as they can, sometimes feeling frustrated that they aren't doing that, and wondered, well, what's happening at these other centers? Could we be in touch and try and troubleshoot together? Think about economies of scale. If there's a particular resource that we should be developing for patients, can we actually come together and do that together and offer patients these resources that at one individual center we can't do by ourselves? So listening to that feedback, we were thinking a lot about how can we pull this group of people together and support them and meet their needs. Simultaneously, a paper was published in the literature showing that that ocular melanoma patients were not receiving the support that they wanted or needed at the time of diagnosis. And so we thought, okay, we really have a mandate here. How can we make sure patients are getting the support they need at the time of diagnosis, and that folks who are working in the clinic feel equipped and armed with the tools that they need to be able to meet the needs of the patients? And so we pulled together the Treatment Center Collaborative Coalition. You can see the participating centers in the pilot initiative. We've been meeting quarterly. We've had 90-minute meetings quarterly. The group has set the agenda, so they have chosen a topic that they would like to learn more about. We've invited speakers to come speak to them on the latest in clinical trials, the latest research, whatever it is the team in the group prioritize. And then we always have time for open discussion. So Q&A for people to ask questions of each other, troubleshoot, and that kind of thing. So far, it hasn't been quite a full year yet, but the feedback we've gotten so far has been really phenomenal. And so we'll continue to get feedback and evaluate the program, and then think about ways that we can tweak the program to make it more effective. And if it continues to be effective, then we definitely want to make sure that we can open it up to other centers who want to engage as well. Lauren, anything else about the TC3 initiative that you would add?
Sorry, I was on mute again. No, I think one of the big things that we've also really tried to include is that social emotional support. So there are a lot of centers who may not have dedicated social workers or dedicated therapists for ocular melanoma. And so this is an opportunity for those folks to also understand the medical aspect of the disease. So then when a patient comes in and starts discussing those types of pieces, they can say, oh yeah, I learned about that from Dr. Ryath or Dr. Carvajal. And then we also, again, have had our social workers from Thomas Jefferson University really focus in on those social support pieces for all of the medical centers so that they have kind of a baseline knowledge and then can take it back. So it's not just learning the medical pieces, but also the social emotional pieces we think are almost more important at times when you're visiting your doctor's offices. And we just want to make sure that that knowledge is passed on too.
Great point. Thanks for that addition. Now I just want to talk a little bit about our research initiatives, and then we'll open it up to questions and let everybody back to your day. So we do have a number of research initiatives. We have awarded over $1.5 million in research. We every year have a call for research grants that we award. They're peer-reviewed research grants. We'll go through that a little bit. We hold scientific meetings every year, a number of 1 to 3 each year. There have been different needs each year, so it's shifted a little bit each year. I'll talk a little bit about our patient registry. We already talked about the TCGA initiative, and then we'll talk a little bit about some of our partnerships. And just to mention, this picture down here on the right, you can see, is from our 2016 Curium scientific meeting. That was actually in Boston. So you'll see some of these pictures smattered throughout. So I just want to bring it back to Greg for a minute. This is an excerpt from a talk that Greg gave at our very first scientific meeting that we planned in 2010. And it was really the first time that, that this group of international researchers had come together in a room, and Greg as a patient stood up before them to welcome them and kind of set the agenda. And this is an excerpt from that talk, which I think continues to be sort of our true north as we think about our research initiatives. So I'll just take a moment to read this. We have a vision. We want a team of experts to focus on ocular melanoma. The more minds we can bring together to look at OM, the better result we might have. The team, no matter what academic halls they walk, approaches they use, research they are pursuing, are willing to collaborate, push the limits, take risks, think outside the box, be aggressive yet safe, be passionate and integrative. And so I hope that in how we're supporting the research community and how we're helping to advance research in this space, we are living up to Greg's vision. And his view was that by pursuing this way of thinking and acting, that this would one day lead us to a cure. And I think that that is something that we all share here at the MRF, thinking about that need for a team. So again, thinking about, well, how do we think about sharing of information and building community collaboration and coordination? Really, we think about bringing people together face to face. And so here are a few pictures of scientific meetings we've held over the years. And they have been all over the world. 2 years ago, we were in the UK. This picture on the left, the 2019 Curium Science meeting was just in the fall in Utah. It's really been, those of you who know the researchers in this space know what a dedicated and passionate group they are. these meetings are just always so inspirational to see the willingness that people have, the drive to share data and figure out how to collaborate and make it bigger and better. And really behind it all, they are so dedicated to patients. And I think that is what is most inspiring when you go to these scientific meetings, is just knowing the passion and dedication that everyone shares for patients. We also, as I mentioned, award research grants every year. These are peer reviewed. And I just thought it might be helpful to see the different levels of awards that we give out every year. So ocular melanoma research has been funded in each of these categories. So the medical student awards, I'll skip the next one for a minute, the established investigator awards, career development awards. And this past year, we awarded our very first Team Science Award in ocular melanoma. And this, again, back to when Greg and I were sitting on the plane, thinking about, the need for that newly diagnosed patient guide. This idea of a Team Science Award was just but a fleeting thought. And we actually were able to achieve that this past year, which is really phenomenal. And we hope that we can really grow that program moving forward. So the idea behind a Team Science Award is to bring together different centers, different disciplines, different levels of researchers, all together onto a team, thinking that, like Greg's vision, thinking that kind of the more minds, the different disciplines you bring together, the better equipped they and we are to really advance science. So that was a huge, exciting win for us that we had the resources to award a Team Science Award this past year. And then the pictures on this slide are images from different labs that are currently being funded by CureOM research awards. And then out of both the research awards and the meetings, we've had a number of publications come out of them. These are a couple of examples of those, including the top one, which is a paper that came out just this past year in Nature Genetics. So it's really great, again, kind of seeing the full cycle of coming up with collaborations at the science meetings that then develop into a research initiative that we're able to fund with our research grants, and then to see that research get out into the community in a publication so that it can form the next cycle of research, and each part of that gets us closer to better treatments and a cure eventually. And then I'll just take a minute, we're getting to the end here, but just take a minute to talk about the patient registry that we are developing. Many of you hopefully saw the press release that came out in February that announced new partnerships that we have with the Massachusetts General Hospital Cancer Center and Global Vision Technologies to develop a first of its kind patient-reported registry to launch in 2020. This is the newly released logo. The registry is called VISION, which is an acronym that stands for Virtual Information System to Improve Outcomes and Networks. So it's the VISION registry, the patient-powered registry focused on a cure. And we have 3 objectives for the registry: to develop and utilize a standardized global patient-reported online registry to provide data regarding the incidence, prevalence, demographics, risk factors, genetics, natural history, treatments, and patient experience from diagnosis through the lifetime of OM, to provide patient-centered data to enhance the care of individuals with OM, and to facilitate collaborative efforts between patients, clinicians, and researchers to improve the outcomes for patients affected by this disease. We have a great working group right now working on this, building the technology platform with Global Vision Technologies. And we're finalizing data sets. This will have oversight from an institutional review board. And we are in the process of submitting all of that paperwork now, making sure all of the security measures are in place, et cetera. But this is very exciting. So stay tuned, the launch of this later in 2020, but we are actively working on this right now. And it's just really exciting to be at this point, getting closer to the launch. So that is sort of a quick overview of the CureOM program. A couple just things to point out of what's to come, and I'll have Lauren add in here a little bit too. But as many of you know, since we weren't able to be together for the patient meeting last week, we have tried to transfer some of the sessions that we had planned for that meeting into webinars. And Lauren and Shelby and others are working really hard on this. We've already had a few webinars launched and there are more to come, so please stay tuned. If you have an idea of a webinar that you don't see us planning or launching, or you don't see it on our website, email us. Our email is right there. I hope if there's nothing you remember from this presentation, it's that we like feedback, we like input, and that's what we need to be a better organization. So please let us know. I've mentioned the launch of the registry later this year. Stay tuned for our I Get Dilated 2020 campaign that will be international this year with some of our international partners. We're very excited to be working with them. We are still planning for our 2020 science meeting this fall. That date has not been moved yet. That will be in New Orleans. We're always working to increase funding for OM research. That's an ongoing project. We are working with our global partners to establish research priorities so that we can have some coordination around the globe as we move those forward. And then this year, our Miles program and our Galas, obviously because of COVID, are going to have to be done a little bit differently, unfortunately. But our team, our very creative team, has put together virtual Miles for Melanoma and a virtual Galas program. So stay tuned. More information should be coming on our website, through social media, and through email on those initiatives, which I'm really excited to see how it works virtually. I think it'll be some fun. We want to expand the Treatment Center Collaborative Coalition, as I mentioned, and then I'm going to just have Lauren talk a little more about what's coming in 30 and 30, and to add any additional details that I may have forgotten.
Yeah, so this session today is being hosted for April 30 and 30. This is a month-long campaign featuring fun virtual events that will bring our community together. And our goal is to raise $30,000 in 30 days to support 10 research grants for innovative medical students to help them advance the melanoma research field. So some of the things that we've done in the past is Cassie led a advocacy session. We've done some really fun kids activities. My husband and I actually hosted on Friday a science activity. So what kind of science experiments can you do with things in your kitchen? So many of those are found on Facebook Live. But just to plug in again that we're really hoping to advance melanoma research with these medical student grants. And so just remembering that their research could lead to a future breakthrough and ultimately a cure to melanoma. And we just are super excited that Sara was able to give us some of her time today in order to have this as part of April 30 and 30.
Well, thank you, Lauren, and to the MRF team for inviting me to be a small part of this. And thanks to everyone for joining. Just thinking back to that CureOM, just being a part of community. I think in general, when you've been affected by rare disease, as you know, Greg and Juliana and I and our families have been, and many of you watching, are and have been, and particularly during the time of COVID, the idea of community is just, it's important upon important. And so I'm so grateful to all of you for being a community around us, and hopefully we can, just go back and forth and give to each other and support each other and work together toward these goals that we've outlined here. So grateful to everyone who's been a part of everything we've been able to accomplish this far, and really looking forward to seeing what I know we can all accomplish together in the coming months and years. So, thanks to everyone in the community. And if there are any questions, we can take some now. And if not, I think we've said that email address enough times. Hopefully you remember it, cureom@melanoma.org. We'd be happy to follow up with you all on email too. So thank you, everybody.
Thank you. Are we